you can better believe that we'll be staying on the job. I'm hopeful that the Supreme Court is going to strike it down on Thursday. Let's see what happens, and then we'll begin to take action after that. Let's go to our next caller, Tracy in Steubenville. How are you?
Hey, Bill. I'm doing fine. Bill, how are you?
I'm doing well.
Good. I want to thank you for what you're doing in D.C. because, you're one of the few that get it, Bill, in terms of what's going on, whether it be the Ohio Valley or other parts of the country, primarily because you're here. I've seen you in Steubenville, I can't tell you the number of times, and I want you to know that I appreciate your involvement in our area and the fact that you really get what we're doing. Bill, I've been in the health insurance business for over 25 years now, and I will tell you that my phones are ringing off the hook, and I'm in the office tonight because we are so busy with people that do not want to participate in Obamacare. And they're doing everything that they can now to preempt whatever happens on Thursday, good or bad, whether it be individuals or businesses, simply because they don't want what's coming down the pike. And I think whether they're Democrat or Republican, people, young or old, I talk to them all day long, Bill, they're just fearful of whatever he's got up his sleeve. And so I just want to tell you from a person that's been doing it for 25 years, in the 25 years, we've never been busier than we have been in the last 6 months.
Well, Tracy, I want to tell you how much I appreciate your kind words. We're not going to give up this fight. I can assure you of that. There's more to do. This is only one step. Let's assume that the Supreme Court strikes down the health care law in its entirety. Now, to me, that would be the best case scenario. We immediately then have to begin a very pragmatic approach to implementing healthcare reforms in a way that the American people can understand and deal with the issues that come up. You're not going to see another 3,000-page piece of legislation that gives Health and Human Services and CMS the ability to interpret and make up the law as they go along. We're going to go after common sense solutions. Many of them I've already articulated and listed off earlier, so I won't list them off one by one again. But we're going to go after healthcare reform in a way that increases competition, that increases quality, that lowers cost, that keeps healthcare decisions between patients and their doctors, and that gets the federal government out of the healthcare business. I don't want bureaucrats in Washington making my healthcare decisions, and I know that your clients and the people that I talk to, they don't want that either. Thanks a lot, Tracy. I appreciate your comments. I look forward to seeing you when we're out and about. We're going to be in Steubenville and Jefferson County an awful lot. We've got 18 new counties in our new district, and we'll be getting out to all of them. So we've been to all of them, by the way, but we'll be out there a lot. So thanks a lot for those kind words. We're going to take another call. Let's talk to Adam in Amsterdam. Hi, Adam.
Hi, how you doing, Bill?
I'm doing good.
I have a question. Good. I'm wondering if there's anything in the works to suspend the implementation of the Utility Act, specifically if seals don't change in November or if the election goes in our favor. Is there any chance of saving all the jobs that will be lost as a result?
Sure. Adam, have you ever heard of the Train Act?
No, sir.
The Train Act is an act that was passed by the House of Legislation that I voted for last year that would have repealed the Utility Act. The very act that you're talking about right now that is forcing the shutdown of coal-fired power plants, we voted last year in the Train Act to repeal the Utility Act. So the short answer to your question is yes, but unfortunately, like I mentioned just a few minutes ago, that legislation sits idle over in the Senate because we can't get Harry Reid and the Democrat-controlled Senate and his ally Sherrod Brown to act on it. So call Sherrod Brown and tell Sherrod to tell Harry Reid to get on the stick and start addressing some of this legislation because it's hurting Ohioans. Ohio gets 87% of its energy from coal, not to mention the thousands of jobs that are dependent upon the coal industry up and down the river. The nation gets 40% of its energy from coal, and yet the administration has got an all-out assault on the coal industry. I've got numerous pieces of legislation that I've either co-sponsored or sponsored directly that will prevent the administration's attack on the coal industry, and we're going to keep that fight up. I believe that there's a future for coal in this country. We've got enough coal to fuel America's energy needs for generations to come, and we can do it, and we can do it right. And we just need the federal government to get out of the way so that we can. So thanks for that question. Excuse me. Hey, if you would like to ask a question, don't forget to press 0. And if you'd like to give us your email address so we can put you on our newsletter distribution list, press 7, and we'll get it out to you. Hey, Jim, down in Salem, how's it going, buddy?
Hi, Bill. How you doing?
Good.
Good. You're doing great work down there in Washington, D.C. We need more people like you.
Well, thank you, Jim. I appreciate that.
You're welcome. I agree with you about the health care in other countries. Their health care is not very good. And you're exactly right when you say their taxes are sky high. Our neighbor Canada is one of them. But you had mentioned, though, if this Obamacare health care is shut down, that you think that the private companies in this country, the insurance companies, the health care cost will go down.
Right.
But I have to ask you a question.
Sure.
The last 20 years, our insurance has went up every year. Our co-payments has went up. And, of course, the bills for the health care has went up. So I'd just like to know your thinking, how you think with competition it will bring down the cost of health insurance.
Yeah, Jim, those are very good questions, and here's the problem. You are right. The private insurance company premiums have consistently gone up, and why is that? It's not just because of the president's health care law. It's because of all of the different requirements that the insurance companies are required to provide, much of which people don't even need. And many people don't even want. That's why the ability to invest in a health savings account and pay for routine health care with pre-tax dollars would drive costs down. But here are two very important points to the question that you asked. What happens when you go out looking for a new car? You don't go to the first car lot that you come to. You shop around. You look for the dealer that's going to give you the best deal. If there was competition in these insurance companies, in the industry, so that they had to work and earn your business like any other industry, you would begin to see the cost come down because you would get a better deal. Right now, today, the insurance companies have a captive market because insurance is not portable from state to state or job to job. You can't go to California and get a health care policy. You can't go to West Virginia or neighboring Kentucky and get a health care policy. You have to buy a health care policy from an insurance company that is licensed to do business in Ohio. And those are the only ones that you can deal with. And so if we could put competition back into the system, by requiring that the insurance industry make health insurance portable from state to state and job to job, you would see quality go up, you would see competition go up, and you would see cost go down. That's how I believe we'll see healthcare costs come down. Folks, I really appreciate you being on the call tonight. Unfortunately, we are out of time. I can see by the list of callers on the list that we didn't get to everyone's question. If you want to ask a question and get us some information, I'll give you the instructions on how to do that here in just a few minutes. But I thought we had a great discussion tonight, and I really appreciate all the questions. If you remember one thing from tonight's call, I want you to remember this. President Obama's takeover of healthcare is full of empty promises covered up in political rhetoric. Not to mention that the president and the Democrats cut Medicare by $500 billion, impacting 36,000 seniors along the Ohio River that depend on Medicare Advantage. I'm working hard to repeal that law in its entirety, and I'm working hard to guarantee the promise of Medicare for everyone and make sure that those that are 55 years of age and older, our current seniors, those who cannot make changes now to their retirement programs, I want to make sure that they see no changes, no decreases to their fully funded Medicare benefits. Because, hey, if President Obama has his way and Nancy Pelosi and Charlie Wilson have their way, Medicare is going to go bankrupt by 2024. That's only 12 years from now, folks, because they don't want to do anything about it, and they refuse to address it. These are tough decisions that have to be made, and if we're going to protect and strengthen Medicare, we've got to be willing to roll up our sleeves and get into it. But today's seniors, they must be protected with no changes to their fully funded benefits. Hey, if you didn't get a chance to ask your question and you want to leave me a voice message with your question, you'll have a chance to do that after the call ends, so just hang on the line. You can also email us through the website at www.billjohnson.house.gov, or you can give us a call toll-free at 1-855-376-0868. And if you're having trouble with a federal agency, we just might be able to help you. So make sure you give us a call, whether it's with the IRS, Social Security, veterans benefits, a passport issue, a grant, you name it. If it's a federal issue, we would love to know what your problem is and see if there's a way that we could help. Hey, folks, we'll be doing this again soon. Thanks for joining the call. It was great to hear from you. Thanks for listening, and have a really great evening. God bless you, and God bless this great nation. Bye-bye.